My name is INDU GUPTA. I am an internal medicine physician. So I started my career as a primary care physician right here in Syracuse, New York. And throughout those interactions with my patients, I started to learn a lot of those things about human health, human nature, human psychology, human illness. Importance of data, importance of all these things which actually can impact person's life. Because when you see a patient, it's more than what you're seeing. It's like a portrait right there. You have to see in context. And the context is that what we actually go and find it in the community or by data or by different thing or by talking to the patient. Before Healthy Connection, to find information from all the hospitals and all providers, if I would not call impossible, but it was very, very difficult. Since Healthy Connection has been in the picture, it has become quite a bit of breath of fresh air because it gives you such a great tool to go and find where the source of information is, and in a real time. That's the beauty of that, you get in real time. So I would strongly advocate that every provider in the community should participate with the Healthy Connection to provide that data to the Healthy Connection, which can be added to improve the health of the community. I always thought individual health and public health are not mutually exclusive. They are complementary to each other. And those complementary roles were very hard to define. And that's what the data piece brings right and fits right perfect in there. That's what the Healthy Connection does. Data is very powerful. I always say data is like a spine of an individual. You know, that's if you take the community as a person, if you make that as a person, data is like a spine or like circulatory system. You can combine them both. You have the most powerful tool which we can use it. As a commissioner, I think I take that beautiful opportunity which has been provided to us and we utilize in health department. So if we have any issues with some public health issues, for example, opioid is a big problem in our community. I have from our medical examiner's office, which is housed under health department, I can say that we have very significant high increasing rate of death in our community. But what I don't have it is how many people are going to emergency room, how many people are being hospitalized, how many people are in some of the other rehab places. Can Healthy Connection that provide that data if these are participating organizing? Of course, yes. And you know what it does? It really gives a great tool to put all those things together. It's like a pieces of puzzle. If this is important to public health, we have capacity and ability to find that information through Healthy Connection. So that provides tool when we do what we call public health intervention, addressing how do we prevent this crisis? How do we communicate with the community where the resources for the treatment centers are? And how do we actually engage our all other community partners, for example, law enforcement and all those also. Just try to show them that this is happening in our community. Data is the one which actually educates us. So in population health, it speaks the volume because that data helps us to advocate for some policy changes, which helps the community. And that's what I like to do, at least in my capacity as a commissioner. And that's what the Healthy Connection has provided a great tool to make that connection, that we can find that information in real time. It is very important. I mean, I can't say enough about that, how important this data piece is to actually serve the community in a much, much better way.